everyone. My name is Candace Ledergerber. I'm a licensed mental health counselor and a registered yoga teacher in Florida. So I like to think of EMDR therapy as kind of like learning to ride a bike and falling off of a bike. So as a kid, you probably rode your bike around the neighborhood, and I'm guessing once or twice you probably fell. Maybe your shins got banged up, maybe your knees or your elbows or your forearms, and there's a good chance that gravel kind of got stuck in those ooey gooey bloody spaces. And you probably limped your way home, right, with your bike in tow. And when you got home, unfortunately, it was time to clean the wound, right? And before you really clean the wound with like soap or water or peroxide or anything like that, you had to make sure that all the gravel was out. Maybe you ran water over it, tried to get most of the gravel out, and sometimes those little tiny pieces just kind of stuck in there. And so maybe you had a caregiver help you with getting out tweezers and, taking out those tiny little rocks. And at that point, maybe you use the hydrogen peroxide or the soap and water and put a Band-Aid on it. Chances are it stung and it hurt like a lot. But before this pain, right, was a different part. Learning to ride the bike, being in training wheels, feeling like you have a sense of accomplishment and mastery over the training wheels, and then riding the bike. Maybe a caregiver behind you, running alongside the bike and holding the back of your seat as you rode your bike without training wheels for the first time. So I think this process of learning to ride a bike and falling off of your bike is really akin to EMDR therapy, because before we process the trauma, before we clean the wound, we really spend a lot of time learning and resourcing and figuring out good coping skills and figuring out how to rely on positive support systems and recognizing your own internal strengths. And I find that when we build that foundation first, before we ride that bike on our own, that before we process that trauma that people are worried about, if we build that foundation first, it's a little bit less worrisome. It's less intimidating. The point of EMDR therapy is to help you build resources, to feel stable, and to process the trauma that's left in your brain and your body that makes it feel stuck. So EMDR therapy can help to clean out that wound, and that way you have a chance to heal. And as you process that trauma, whether it be little or big, whether it's across a multitude of years or whether it's one big event, you might find new perspectives. You might find new shifts, right, in your thoughts. And I will say it can be scary. It can be challenging. It can be complex. It can present you with a wave of emotions that are difficult and hard and disturbing. And with my whole heart, I truly believe that the therapeutic relationship, the resourcing, the finding of coping skills, the support system around you, the internal strengths that you learn about yourself, all of those things set that foundation so that way you can process the trauma. So that way trauma does not have to continue to haunt your life. So if you're interested in maybe learning more about EMDR therapy, or you're wondering maybe if EMDR therapy is the right fit for you and you live in Tampa or in Florida, I really encourage you to contact me for a free consultation. I'd be happy to chat with you, see what your needs are, and if I'm not able to meet your needs, or maybe you don't feel a good click, I'm happy to reach out to the network of people that I'm connected with to find you a better professional. Thank you all for watching. Have a great day.